Welcome to the Pre-Op and Discharge Instructions video series. This three-part series contains important information regarding your upcoming procedure. Please listen carefully and take notes if needed. You can also watch this slideshow again, if necessary. Our surgeons work at two facilities in Cincinnati. The first being Journey Light, our outpatient surgery center that specializes in weight loss procedures. The address is 10475 Reading Road, Cincinnati, Ohio, 45241. The website is journeylight.com. If you are having your endoscopy or surgery there, please go to the site and click on the pre-registration link at the upper right-hand side of the screen to pre-register for your procedure. This is very important and should be done immediately. For out-of-town patients of Journey Light, an overnight stay will be provided at the Wingate Inn, which is about a mile from the center. For more information, go to wingatecincy.com. If you are from out of town and having an ESG, gastric sleeve, bypass, or SIPS, at Journey Light, you will be discharged from Journey Light and spend the night at the Wingate. You can return home the following day. You will not need to be seen in the office prior to Levittown unless you are having issues that need to be checked out. Our inpatient hospital facility is the Jewish Hospital in Kenwood, at 4777 East Galbraith Road, Cincinnati, Ohio, 45236. So let's get started. All patients will be on a prescribed diet prior to surgery. The length of your diet will be determined by your body mass index. This is extremely important to the safety and efficacy of your procedure, and is designed to shrink the liver and reduce the risk of surgery. Our registered dietitians will teach you in detail regarding your specific plan. Next, let's talk about diabetes and the pre-op diet. It's important to know that your blood sugars will start coming down right away on the pre-op diet. Typically, we will reduce all of your diabetes meds by half of your normal dose, but a provider will go over your meds in detail at your consent visit before you start your diet. If you take any blood thinners, you will need to modify your regimen around your surgery. Most blood thinners, such as aspirin, Plavix, Pletal, and Mobic, must be stopped 1 week prior to surgery. If you take Coumadin, Eliquis, Pradaxa, or Xarelto, you will need to take some special precautions, so please talk to a provider at your consent visit. You will need to stop these medications at least 2 to 7 days prior to surgery, and you may need a temporary injectable blood thinner called Lovenox. All over-the-counter anti-inflammatories except for Tylenol are mild blood thinners and must be stopped 7 days prior to surgery. This includes common medications such as aspirin, Motrin, ibuprofen, and Aleve. Lastly, steroids and immunosuppressants are preferably stopped 2 weeks prior to surgery as well. If you feel you are unable to completely stop these medications, discuss a plan with the prescribing physician to wean yourself down to the lowest dosage possible, and discuss this with the provider at your consent visit. You can safely resume these medications 4 weeks after surgery. You will need some pre-admission testing prior to your procedure. If your surgery is at Journey Light, you will get this done on the day of your consent visit. A consent visit is an office visit that occurs prior to surgery, where you will meet with the provider, make sure all your surgical clearances are in order, and discuss the risks and benefits of your specific procedure as well as any remaining testing that needs to be done. Consent visits can be done in the Cincinnati and Columbus offices. In some cases, you can arrange for your pre-admission testing to be done by your primary care physician, but this is a special circumstance that must be approved by one of our providers. If you are having surgery at Jewish Hospital, you will need to contact them to arrange your pre-admission testing by calling 513-686-3827. Please get this scheduled as soon as you can, once you get your surgery date. Next, let's talk about medications on the day of surgery. As usual, you can't have anything to eat or drink after midnight prior to the procedure, and you must bring someone that can drive you home. On the morning of surgery, hold all of your regular medications except those that are for blood pressure. During your pre-admission testing visit, if anesthesia tells you to follow different instructions, please do as they say. If you are on Lovenox or heparin injections, do not inject yourself the morning of surgery, as this could cause serious unwanted bleeding issues. As a side note, if your surgery is at Journey Light and you have sleep apnea, please bring your CPAP machine with you on the day of the procedure. After surgery, you will be instructed on which of your regular medications to resume and which to stop. You can swallow pills of any size after surgery. Please do not cut or crush your medications. You will need to avoid heavy lifting after surgery to avoid damage to your incisions. You can start out lifting 10 pounds in the first week, and increase by 10 pounds in each subsequent week. If you want to start exercising during this time, stick to walking and avoid strenuous cardio. After 4 weeks you have no lifting restrictions, and may return to full exercise with no restrictions. Avoid driving for at least 3 to 5 days after surgery. You must be completely off of your pain medications before you can drive. After surgery you may return to work in 1 to 2 weeks if you have a light duty or desk job. If you have a lifting job you may return in 4 weeks. Please bring any FMLA paperwork to your consent visit so that we can have it ready for you in plenty of time for your surgery date. Congratulations on completing the first pre-op and discharge instruction video. Please continue to the next video entitled Post-op Meds and Activity.